Welcome back. We've traveled again up I-29 to Tiffany Springs Parkway and headed over to the offices of Mid-American Wealth Advisory. Mark, we are back in your office again. Thanks for having us here.
Hey, thanks for coming.
Well, we need to talk about long-term care today. I know it's an important step in looking out for our future. What is the importance of long-term care to your clients?
Well, if you're under the age of 50, long-term care really probably isn't in the forefront of your mind. But when you get 55 and above, it becomes a very important topic. I have it myself personally. So what is long-term care? Basically, they say 1 in 2 people to half the people, according to Johns Hopkins medicine, are going to end up in hospice, i.e. a nursing home. Nursing homes are very expensive. The average cost of a nursing home in the Midwest United States is almost $100,000 a year. Now there's a bell curve of people that if your assets are probably $4 million and above, you might be self-insured. But the vast majority of the people that have assets are right in that middle of that bell curve, and they need to protect the assets from something called Medicaid spend down. So if you don't have the assets or a long-term care policy, there's 2 formats of government health care, Medicare and Medicaid. Medicaid is only one job, and that is to pay for long-term care. It will pay, but you have to be broke, and that's called Medicaid spend down, and people don't want to go through that. So that's why you have long-term care.
Walk us through some of the Medicaid, Medicare situations that you run through here.
Well, so when a person hits 65, they get on Medicare, and everybody needs a Medicare supplement. And I strongly advise people to get the G plan. I don't want to get too far in the weeds here, but there's an Advantage plan that is very non-advantaged. It has very high deductibles and it'll break you. The G plan is pretty good. You know, people ask me what is an average cost for a 65-year-old? $250, $300 a month for husband and wife. But then there's Medicaid. Medicaid only has one job, and that is to pay for a nursing home. And it will. But if you're a married couple, you have to have under $120,000 in assets, 1 home, 1 car. If you're single, $2,000. Anything over that, and you're considered too much money. You got to spend it down.
Oh, so there's a lot of kind of technicalities, I guess, when it comes to Medicaid then?
Yeah, so you've got to be broke. And believe me when I tell you, they don't take your word for it. They check this stuff every 3 months, and they don't take your word for anything.
What are the different types of long-term care that you help people prepare for?
Long-term care is an interesting topic. I've been in the financial services industry for 35 years, and it's interesting to see the industry. I've only literally seen them do this 3 times in my whole career. And that is, they come out with a product that they don't know how to price. The policies that were sold 15 years ago were better than the ones now because the insurance companies didn't know the true cost of long-term care, and they about priced themselves out of business. So long-term care is either 2 types, built on a health insurance chassis or a life insurance chassis. Health insurance goes up every year. We don't sell it. I don't like it. I think a person is going to be priced out of it at about age 82 when they need it the most, and the insurance company laughs all the way to the bank. The life-based type is the type that I have, and it never goes up in price. I'll tell you another thing a person can do, and this is a real easy, quick fix. Go buy very inexpensive 20-year term life insurance and make sure it has a long-term care rider, because many of them will let you use the death benefit as a health rider while you're still alive. And that is a very cheap way for a young person to buy long-term care and kind of do a little hack there, you know.
Well, to learn more about long-term care plans connected with Mid-American Wealth Advisory, call 816-640-5888 or go to midamericanwealthadvisory.com.